So you could have significantly less pain in your knees if you focused on this one thing. What's up, y'all? This is Carolina Doc PT, and today we're going to be talking about one thing that is really important and can do a lot, or could give you a lot of benefit if you're having a lot of knee pain, and it's something that people don't discuss very much. And I'll tell you, I'm guilty. I rarely mention this particular issue with my patients, and that's wrong. I should not do it. But the reason that I think I haven't done it, as I say, I'm throwing myself under the bus first here, and the reason I think other healthcare professionals don't discuss this as much, although I have heard orthopedists occasionally discuss this, is I think just in our society today, it's maybe not totally acceptable to discuss this, and that's wrong, because you're not helping patients by avoiding this subject. And that topic is losing weight. You really think about this more in relation to knee pain, because those people who are walking around with less weight on your joints is going to mean your joints don't have to work as hard. If your joints don't have to work as hard, they're not going to wear as badly. And if they don't wear as badly, you're going to have less pain. And so it's almost a no-brainer. I mean, I believe the stat is that for every 10 pounds of weight gain, the increased force across your knee joint increases by 4 times. So that's 4 times as much force that's being distributed across your knee joint by just gaining 10 pounds. So conversely, if you were to lose 10 pounds, you're going to decrease the force going across your knee when you're working by a factor of 4, or 4 times, let's say. Or more accurate to say. So that's incredible. And yet we don't discuss that really. And as I say, I don't. I haven't, and it's something that I'm going to need to start doing, just as I was researching this video a little bit and thinking about it. I kind of was asking myself, why am I not doing this? Why am I not discussing patients' weight with them? Because that is probably one of the single biggest contributors to the success or failure, I would argue, of a successful knee rehabilitation. And really, I think you could factor that across multiple things, whether that's having a knee replacement, whether that's having an ACL surgery or a meniscus surgery. It is just thinking back on the patients that I've worked with over the years, those folks who are carrying around significantly more weight, it's just harder for them to go through rehab, whereas those people who are more in a normalized body weight and BMI range, they tend to do better. And I mean, certainly there are other comorbidities involved, like diabetes and coronary artery disease and peripheral vascular disease and all these other things that we know come along with increased weight. But people don't really stress the need for patients to really focus on their weight and drop weight if they're having knee pain. And I'll tell you where it's probably even more important. Like, all of us know about that morbidly obese person who is they're 200, 300 pounds overweight, and we know that their knees are generally not going to be doing super well. But that person who is just a little bit overweight, it's really probably where we could almost have a bigger impact, because if we're focusing on those patients make up a significantly greater number of folks than are just morbidly obese, super heavy folks in our society. So I'm talking really more to that person who needs to lose like 10 or 20 pounds. Hey, and believe me, I recognize the irony of me right now in the way that I've let my body get out of shape. The irony of me discussing this subject and this particular topic, it is not lost on me. Okay. So save the jokes and save the comments and on this video. Yes, I am exactly in this category myself. I need to drop 10, 20. Actually, I probably need to drop 50 pounds to be perfectly honest. I'm way overweight and I'm got to do something about it, and I'm going to be doing something about it. So that's another topic, another video series that you'll hopefully be hearing about very soon, Lord willing. But losing weight for those folks who are just a little bit overweight, as I mentioned just a few minutes ago, that if you could reduce the factor or reduce the workload that is being distributed across your knee joint by a factor of 4, I keep saying by a factor of 4, it's times 4. I think that's what I'm saying, factor of 4, that's significantly a different number. So pardon me, math is not my strong suit. All right. Like, I'm a physical therapist. All right. I'm not a math guy. But times 4, if you could decrease that work times 4 across your knee joint by just losing 10 pounds. I mean, if I was a person walking around and my knees were, killing me, I think that's the first thing that I would try to do. And it certainly is the thing that is the easiest for you from the standpoint of it's easier for you to have a direct impact on that. If you're talking about a surgery, that type of stuff, you got to get the orthopedist involved. If you're talking about rehabilitation and going through physical therapy, you have to get a physical therapist involved. So, can an orthopedist help with that? Yes. With the surgery? Yes. Can physical therapy help with that? Yes. By, doing a lot of work. But the thing that's the most modifiable for the patient is what I'm talking about, that they can do on their own if they would just focus on it and work on it some. That's weight loss. And yet we're not discussing it a whole lot. And so that's the point of this video, I would say, is I'm just trying to call attention to something that is a very obvious thing, that and maybe that's a little bit of why I'm trying to think of why I have not talked about this myself very much with my own patients. And maybe it is something that it's a topic that you just kind of assume that the patient realizes this. There are a few times where I've discussed weight loss with patients, but it hasn't been, especially not with that patient category where, hey, you're just like 20 pounds overweight and you're coming to me with knee pain issues. What really should be a thing there is we should say, hey, look, your goal needs to be, you need to drop 10 pounds in the next 3 months. If you can do that, your knee pain is going to drop. If we can increase the strength of your hips while you're doing that, then you're going to be golden. And you might even avoid that upcoming surgery. So I would say that and I'm putting this under the knee pain category, but I'm also going to say, I mentioned at the top, this isn't just for those folks that are walking around with arthritis in their knees. This would also apply to those folks that are having pain in their knees after they've had a knee surgery. A lot of times those patients that are a good bit overweight, or even a little bit overweight, may have a little bit more of a struggle after having had that surgery. Whereas if they would go into the surgery, have that, or if they're going into their surgery at a particular weight, they have that surgery, they have a new joint in their knee, or they have a new knee joint, let me say. And then if they were to combine that with dropping 10 or 20 pounds, so now that knee joint is going to just move so much better. Like that really needs to be a factor. And that's really the ultimate point of this video. If you're someone who's out there experiencing a lot of knee pain, if you're somebody who is going into a surgery, or if you have had a surgery and you're coming out the other side of it for your knees, focus on losing some weight. Try to get down. If you're walking around and you are 10 or 20 pounds overweight, 30 pounds overweight, 40 pounds overweight, certainly, you need to focus as a part of your rehabilitation on dropping pounds. More so than even on, what the ideal body weight is. We all understand, that's would be good for us. But what I'm really talking about more is those folks that are a little bit overweight and you're coming to the physical therapist or orthopedist complaining of knee pain. Go ahead and try dropping 10 pounds and see what that does to your knee pain. Drop 20, 30 pounds. Now there becomes the question, well, how do I do that if I'm having knee pain? So certainly the main and number one thing or way to do that would be dropping calories from your overall meal plans per day. You can do that in a lot of different ways, whether that's going on to a particular diet, whether it's just eating healthier, whether it's cutting out sugars and junk food, etc. You also, so that's really a significant way that you can really impact your weight without doing any exercise. If we're talking exercise and you're having knee pain, what I would recommend is find at a local gym your elliptical trainer. I really haven't run into too many patients. I'm thinking back over a long period of time when I used to personal train and even on the physical therapy patients that I've had that couldn't use a elliptical trainer. The elliptical trainer is so much better for folks because you don't have that consistent pounding on your knee. So you have this, it's kind of a smooth circular motion. So it's kind of like a combination of running or walking and biking all at the same time. And so your knees can usually tolerate that motion and that particular exercise machine really well. Can tolerate it certainly better than running, probably better than biking, and even likely better than walking. As I say, it's kind of a combo of all of that, and I would highly recommend you seek out that device on or at your local gym and start getting into some extra exercise, cutting your calories while you're doing that. That should start to equate to some weight loss there. And if you do that, your knees are going to have much less pain, and then maybe you can avoid that surgery. Or if you've already had the surgery, you're going to come out the other side of that much better and stronger if you decrease the pain, or excuse me, if you decrease the weight of your body after that joint has been replaced and after you have that new joint put in. So I kind of rambled there a little bit, but I think you get my meaning and get the point. Losing weight is very beneficial for folks, especially those that are having knee issues. So I hope that this maybe has been a little informative to you. Maybe it's been a little bit of a kick in the pants to some folks. And so hopefully it will help prod you along so that you can have less knee pain and a better quality of life. All right. We'll catch y'all next time. Later. Bye.